Peter Greenwald, Director of Cancer Prevention for the National Cancer Institute.
Thanks. Let me just mention several things. One, we have several clinical trials, which are the strongest type of evidence about selected vitamins, not multivitamins. They're not trials of breast cancer, but I want to mention them because they illustrate some of the issues and concerns we have. The first one we did in collaboration with some Chinese scientists, where the aim was to see if we could prevent some cancer of the esophagus and stomach in a place where it's the highest rate in the world, one of the highest rates. And after giving a combination of vitamin E, selenium, and beta-carotene, we found that stomach cancer was about 20% less common. The interesting thing was that 10 years after stopping the intervention, 10 years after stopping, the difference was greater than it was at the time we stopped. And it's very similar to tamoxifen results, that it seems that the time in carcinogenesis, if it's early, the time during your life when you're doing these things, may have an effect. And in this case, it was a beneficial effect. There are two other studies that lead you to draw a caution. We worked with some Finnish scientists on 29,000 smoking men to see whether vitamin E or beta-carotene could prevent lung cancer in smokers. And it came out that it was worse, that the men taking beta-carotene did worse, and they got more cancer of the lung. And you know, Joan Brugge mentioned antioxidants. To me, most of these things are what we would call redox systems. In some situations and some cell environments, they're antioxidant. In other situations, perhaps with the drive of tobacco and the aerated lung, they're pro-oxidant. There's not a simple answer. And another thing, there might have been a little news clip just earlier this week, where we're doing a study of 32,000 men who were taking vitamin E and or selenium or placebo to see if it would prevent prostate cancer, because we had some good leads that it might. And the trial was stopped by the Data Safety Monitoring Board because there was no benefit after 5 years. And in fact, the trend, not significant, but the trend was going in the wrong direction with vitamin E and prostate and with selenium and diabetes. The trend was the wrong way. So you cannot jump to the conclusion. My feeling is, number one, the way you live your life affects your chances of getting cancer. And there are public health things. Keep trim. We know weight gain as an adult increases postmenopausal breast cancer. There may be a risk from alcohol. We think exercise and the way your environment is it safe to get exercise, is important. So the other thing is, in a research thrust, we need to address nutritional science as fully and aggressively as we do pharmacology, and we have not done that. So there's a lot of epidemiology, as Walt Willett mentioned. It's very good. But to me, it's not sufficient if we don't have more in the way of basic nutrition science and clinical trials, including piggybacking in the early trials between basic science and trials. Yes, results. Red wine.
Okay.
Yeah.
Yeah.
Well, it's the same thing. There is resveratrol, which is sort of an antioxidant.
Okay. All right. I think we should stay away from specific chemicals in terms of advice, because otherwise we can get into.
All I would say is, on survivors, maybe during early therapy, but there are a lot of survivors who live many, many years now, and for them the same principles evolve. But if you're taking it during therapy, some of these things may interfere with their
hope.
I think, from the clinician standpoint, our patients are always saying to us, okay, now I have cancer, what should I do? And what should my children do to put themselves in the best situation? And what we know now, and what you've just heard from people who've really found, been the foundation of all of this work, is that Everything in moderation is the approach, except for I tell people no cigarettes. But, there are obvious things that are very bad, but really, it's our whole life exposure to the environment that determines what our risks are as adults and as aging people. So there is actually a body of research looking at following children who were 6 and 7 in the California Kaiser system and watching their diet, their lifestyle, et cetera, over time, their weight, and trying to look at these risk factors over time. So from a patient's standpoint, it's everything in moderation. A glass of red wine is not going to hurt you. A lot of red wine is not probably a good idea. Red wine during chemotherapy, not a good idea. The same kind of thing with vitamins. You want to make sure that your vitamin D is adequate for your bone health, but then we don't want to take a huge amount of any one vitamin because we don't know what the adverse effects are.